If you use this homemade remedy on your hemorrhoids for 1 week, you may notice significant results. But relax, I'm not here to fool you or sell you anything. I'm here to show you the truth. So if you enjoy content like this that tells the truth, subscribe to the channel and comment your age below. That way I can get an idea of my patient's age range. You wake up in the middle of the night with that burning sensation. You go to the bathroom and the toilet paper confirms what you were already afraid of. A thin streak of fresh blood, bright red, shining. The pain is so specific, so intimate, that you feel embarrassed to even ask for help. Then someone in the family drops that line that sounds like it's about to save your life. Just put some aloe on it. It works right away. And you, desperate for relief, go to the kitchen, grab that aloe plant your mom keeps by the window, cut off a piece, scrape that clear gel out, and apply it directly to the most sensitive area of your body. I've been a physician for almost 20 years, and I need to tell you something before anything else. That scene I just described, I've seen it play out dozens of times in my office. And in more than half of those cases, the patient came in worse than if they had done nothing at all. Aloe vera has become the go-to home remedy for hemorrhoids in America. You ask any neighbor, any aunt, any grandmother, and the answer is always the same. Aloe heals it. And the truth, the medical truth backed by evidence, is way more complicated than that 8-word sentence. Some things work, some things can hurt you in ways you can't even imagine. And there's something nobody tells you, because in folk wisdom the detail gets lost. And the detail is exactly what separates relief from a trip to the ER. Stick with me until the end, because I'm going to walk you through the 3 most dangerous myths about using aloe vera on hemorrhoids. And the third myth is the one that sends the most people to my office with their skin raw and inflamed, not even knowing what happened. Before I take down the first myth, I need to be honest with you. The title of this video talks about a home remedy with aloe vera. And my commitment to you isn't to sell you a miracle plant or to bash a popular tradition. It's to give you the truth. Aloe vera, scientifically known as Aloe barbadensis, has real properties, proven in serious studies. It has anti-inflammatory, healing, and soothing effects on irritated tissue. That's a fact. But how you use this plant changes everything, and that's where the danger lives. Let me walk you through the first myth, and it might be the most common of them all. Myth number 1. If it's natural, it can't hurt you. That sentence is the doorway to half the problems I see in my office involving medicinal plants. People think anything that comes from nature is harmless, that the worst that can happen is that it just won't work. But natural doesn't mean safe. Snake venom is natural. Poisonous mushrooms are natural. And the raw stem of the aloe plant also has components that can irritate, burn, and damage sensitive tissue. Let me explain what science shows us. There are 2 parts inside an aloe vera leaf. The clear gel, which sits in the center, and a yellowish layer right under the green skin, called latex. That latex contains compounds called anthraquinones, especially one called aloin. Think of that latex like a harsh detergent. It's so irritating that when swallowed in any amount, it causes severe diarrhea. And when applied directly to an already inflamed area, like a bleeding hemorrhoid, it can cause a severe chemical burn. Margaret, 56 years old, a home cook from Tulsa, Oklahoma, mother of 4, grandmother of 7. She walked into my office on a Tuesday morning with her face tight with pain. She told me, in a low voice, almost apologizing for being there, "Doctor, I tried to take care of it at home. I cut the aloe from the plant on my kitchen windowsill, the one my mother gave me years ago. I applied the gel just the way it came out. It kept getting worse, doctor. Today I can't even sit down properly." When I examined her, I found a clear chemical irritation, with small erosions across the perianal tissue. It wasn't the hemorrhoid that got worse. It was the direct application of the stem, with the latex and everything, that caused a severe contact dermatitis on top of an already damaged area. And it wasn't her fault. Nobody had ever explained to her the difference between pure gel and the latex from the skin. Notice this detail. The plant is the same, but how you use it changes the result completely. And that's exactly the detail that gets lost when the recommendation comes through as a household saying without any technical guidance. Now let me take down the second myth. And this one is one of the hardest to fight, because on the surface it sounds logical. Myth number 2. The fresher the plant, the better it works. Folk wisdom says cutting the leaf right then and there, applying it fresh, guarantees maximum benefit. And I understand where that logic comes from. Fresh fruit is better than old fruit. A vegetable picked today is better than one from a week ago. So why would aloe be any different? That's the point. The problem isn't freshness. The problem is context. An aloe leaf you cut at home comes with dust, with airborne particles, with bacteria, with possible residue from cleaning products or pesticides used near the plant. And you're applying that plant to a part of your body that already has a fragile mucosa, possibly with tiny fissures, possibly bleeding. Think with me for a second. Would you wash an open wound with water from the garden hose? Would you squeeze fresh fruit juice directly from the peel onto a cut on your hand? Probably not. But that's exactly what a lot of people do when they apply fresh aloe, straight from the plant, to the anal area. Studies published in dermatology and integrative medicine journals show that the topical use of aloe vera is only considered safe when the gel is extracted properly, purified, separated from the yellowish latex, and ideally combined into a stable pharmaceutical formulation. Researchers at the University of Maryland Medical Center, in a review on the therapeutic use of aloe vera, were clear. The pure processed gel has a healing effect. The raw stem, with the latex, can cause contact dermatitis in up to 30% of people with sensitive skin. And you know what else? When that dermatitis happens in the anal area, it turns into a nightmare. Because the area sweats, rubs against clothing, against stool, against toilet paper. Healing is slow, the pain is constant, and the original hemorrhoid, the one that started it all, gets pushed into the background, forgotten underneath a much worse irritation. Before I reveal the third myth, which is the most dangerous of them all, I need to ask you something. If this content is helping you, if you're learning something you might never have heard before, please hit that like button right now. That simple gesture helps this video reach more people who are suffering in silence with this same problem. And if you haven't subscribed to the channel yet, do that now and turn on the notifications. Drop a comment telling me what city you're watching from. I love seeing where this community is growing. All right, let's get into the third myth, and pay close attention because this one is the trickiest. Myth number 3, if it felt better right away, it must be working. This is the myth that worries me the most in my daily practice, because it fools the patient at the exact moment they should be reaching out for help. Let me explain. When you apply aloe gel to an inflamed area, the immediate sensation is cool, refreshing, soothing. That happens because the gel is rich in water, sits at a lower temperature than your body, and contains compounds with a mild local numbing effect. Your brain reads that coolness as improvement, and the person thinks, I found the solution. But here's the thing almost nobody talks about. Symptom relief is not the same as healing. Turning off a fire alarm doesn't put out the fire. And a hemorrhoid that stopped hurting because of the cooling effect of a plant might be, silently, evolving into something much more serious underneath. Mr. Anthony, 68 years old, a retired construction foreman from Allentown, Pennsylvania, father of 3, grandfather of 5, a tough guy, the kind who doesn't like hospitals. He came into my office with his daughter after almost 2 months treating a hemorrhoid with aloe from his backyard plant. His daughter told me, Doctor, he kept saying it was getting better, that he didn't need a doctor, but the fever started yesterday, and today he can't even get out of bed. When I examined him, I found an extensive perianal abscess, a deep infection with pus with necrotic tissue. What started as a hemorrhoid with a small fissure had become a doorway for bacteria, and for weeks, while the aloe gave him that cooling sensation, the infection was spreading inside. He needed emergency surgery, IV antibiotics, 5 days in the hospital, and he told me, before they wheeled him into the operating room, with his eyes welling up, Doctor, if I had known something was growing inside, I would have come sooner. I thought I was getting better. Look at that. He wasn't reckless for using aloe. He was tricked by the relief. And that's the trap this plant creates in more serious cases. A hemorrhoid isn't always just a hemorrhoid. It could be an anal fissure, it could be a fistula, it could be an abscess, it could be, in rare but real cases, an early sign of colorectal cancer. And no gel, no matter how natural, can diagnose any of that for you. What hurts me most as a physician isn't when a patient walks in with a serious diagnosis. It's when they tell me, I felt these symptoms for months, but I was using a home remedy and I thought I was getting better. Delay in diagnosis is very often crueler than the disease itself. And this is where the conversation gets really important, because so far I've shown you what not to do. But I didn't come here just to take away your hope without giving you an alternative. So now that you understand the 3 myths, let me tell you what actually works. And I'll be direct, practical, actionable. The first thing that works, and the science backs this up, is using products with aloe vera that's been processed properly. Creams, ointments, and gels sold at the pharmacy, with stable formulations, with the gel purified and separated from the latex. These products have proven local anti-inflammatory action and can ease the symptoms of uncomplicated external hemorrhoids. The difference between the raw stem and the pharmacy cream is the same as the difference between drinking from a river and drinking filtered water. The starting material is similar, but the purification process is what makes the use safe. The second thing that works, and a lot of people underestimate it, is warm sitz baths. A clean basin, comfortably warm water, 10 to 15 minutes, 2 to 3 times a day. That bath relaxes the local muscles, improves circulation in the area, eases the pain, and helps with hygiene. It costs almost nothing, and it's safe. Think of it as a natural therapeutic compress, with no risk of contamination. The third thing that works is paying attention to what goes into your mouth. And here the numbers are striking. Most hemorrhoids develop because of repeated straining during bowel movements, usually tied to a diet low in fiber and not enough water. Increasing fiber intake to 25 to 30 grams per day, drinking at least 8 to 10 glasses of water, and avoiding sitting on the toilet for long stretches scrolling on your phone are more effective measures for treating hemorrhoids than any plant. Plain and simple, the problem starts at the dinner plate and on the toilet seat, not at the home remedy shelf. Mrs. Eleanor, 62 years old, a retired school teacher from Cedar Rapids, Iowa, mother of 3, grandmother of 2. She came to my office 6 months ago with grade 2 internal hemorrhoids, frequent bleeding, and a lot of anxiety. She had tried everything at home, including aloe straight from the stem. Once we started proper treatment, with appropriate cream, sitz baths, dietary adjustments with more fiber and plenty of water, the change came within a few weeks. She came back for a follow-up 3 months later, smiling, and told me, "Doctor, it feels like something shifted inside me. I'm not scared of going to the bathroom anymore." That sentence, as simple as it is, stayed with me. Because hemorrhoids aren't just physical pain, they're fear, they're shame. They're losing the comfort of something as basic as going to the bathroom. Now I need to warn you about something important. There are situations where no home treatment, no matter how well done, is going to solve the problem. And you need to recognize these signs. Bleeding that persists for more than a week, even with changes in your habits. Intense, constant pain that doesn't respond to a basic pain reliever. A hard lump in the area, especially if it's tender to the touch and growing. Fever, chills, or general feeling of being unwell along with anal discomfort. Pus or discharge with a strong odor. Any one of these signs is reason to see a doctor right away. It's not overreacting. It's not being dramatic. It's about your safety. And anytime you're going to make a change to your treatment, talk to your doctor. That's a rule that never changes. Every case is its own case. What works for your neighbor might not work for you. And an in-person evaluation with a physical exam can't be replaced. Let's recap what we learned today. First myth, busted. Natural doesn't mean safe. The raw stem of the aloe plant contains an irritating latex that can make wounds worse instead of healing them. Second myth, busted. Fresh doesn't mean better. The raw plant, without proper processing, can introduce contamination to an already fragile area. Use pharmaceutical products with stabilized aloe vera, not the stem from your windowsill. Third myth, busted. Relief is not the same as healing. The initial cooling can mask a deeper infection, an abscess, or even a more serious problem that needs medical diagnosis. Your body isn't your enemy. When it bleeds, when it gets inflamed, when it hurts, those are signals. They're calls for help that deserve to be heard with seriousness, not silenced with a household trick that just seems to work. Aloe vera has its place in medicine, yes, but that place is inside a product prepared with care, with technique, and within a well-guided treatment plan. Share this video with that family member who recommends aloe vera for everything, with that friend who's suffering in silence with hemorrhoids and feels too ashamed to look for help, with that father, that grandfather, that uncle who would rather use the backyard than visit a doctor. This information could prevent an ER visit. It could spare a surgery. It could shorten someone's pain. In the next video, I'm going to walk you through the 5 foods that most aggravate hemorrhoid problems in America, and the number 1 is going to surprise you, because a lot of people consider it healthy. You don't want to miss it. Take care of your body with respect. It has more wisdom than any folk saying, and it deserves to be treated with the truth, not with what just seems to work at first glance.